יוצאת מן הכלל להראות את המורכבות של הקשר, וביחד עם זאת את יכולת העשייה של המשרד ברמה יוצאת דופן טובה, ואני מתכבדת להזמין למושב השני והמיוחד מאוד שלנו שתי נשים מאוד מיוחדות, פרופסור מרים בן פרץ, יושב ראש המושב, ופרופסור ג'ודי סבא מאוקספורד יוניברסיטי בבריטניה, לשאת דברים. תודה.
בוקר טוב לכולם. שמי כמובן מרים בן פרץ ולא מיכל בלר, וגם לא הייתי יכולה לעשות מה שהיא עושה, האחריות של הדירה, ואני שמחה להיות כאן. הנושא הזה שאנחנו התכנסנו לדון בו הוא כנראה הנושא היותר חשוב מכל הנושאים שאפשר לדון בהם, מפני שמחקרים יש אין ספור, ואפשרויות השימוש בהם מצומצמות ביותר, ואנחנו עוברים עכשיו, ובעוד דקה אני אציג את פרופסור סבא, אנחנו עוברים לצד השני של המשוואה. שמענו על המחקרים וחשיבותם והתכונות שלהם וההכללות האפשריות. שמענו גם מפרופסור בן-אלישטיין על החשיבות של ההכללות המקומיות, העדויות המקומיות, התרבות המקומית, התנאים המקומיים, ושמענו גם על תוכנית אחת שמתבססת על מה שקוראים evidence-based הכללות, conclusions, suggestions. אבל לא שמענו הרבה, ועכשיו אני מאוד שמחה שבעוד דקה נשמע את פרופסור סבא. לא שמענו על מה קורה בצד הזה של היישום, ואיך מעבירים את הידע הזה, ואיך הוא נקלט, ומה קורה איתו, ואיך אפשר להבטיח שהוא בכלל יקלט, ואיך מגישים את הידע. ועל הדברים האלה נשמע בעוד דקה פרופסור סבא. I'm now moving for a moment to English. It's my pleasure and my honor to introduce Professor Jody Seller, who is director of the New Center for Research on Fostering and Education at the University of Oxford, the Department of Education. Professor Seba was Professor of Education and Director of Research and Knowledge Exchange. Please pay attention to this term, knowledge exchange. In the School of Education and Social Work at the University of Sussex. In 2009, she spent 4 months as visiting professor at the University of Toronto, looking at research mediation. And research mediation is probably the most important term that we can have. She was senior advisor for the research strategy at the Ministry of Education in England between 1997 and 2003. She is deputy chair of the Research Excellence Framework sub-panel on education, which will assess all research in the UK in 2014. This is a rather grave and important task. She was a member of the 2008 Research Assessment Exercise sub-panel on education. She co-directed the Economic and Social Research Council seminar series with Professor Ann Edwards and Dr. Mark Rickenson on user engagement and research. Another central term, user engagement and research, for which their book, Improving Research Through User Engagement, was published in 2011. And again, it's my pleasure to have you here. And now it's your turn. Thank you very much.
Just a bit of coordination required, a horrible sign of age with the glasses, the hearing aids, the translation. I just tried not to get in too much of a mess. Thank you very much to the Academy and to the Ministry for inviting me to join this very interesting and great opportunity to discuss these issues which are very close to my heart. I've already found the people I met yesterday most stimulating. Unfortunately, I've already made too much use of the Israeli hospitality, and I could barely fit the transmitter onto my trouser waistband this morning. And I think it's no criticism at all of our hosts, but it's interesting that we don't ourselves use the evidence that we have, because we sit here for 2.5 hours listening when we know that only 12 minutes of any hour's lecture ever gets absorbed. So we are ourselves not great users of evidence. And it is interesting that Ben Levin, whose work I'm going to quote several times in here, and others have shown that universities themselves are not great users of research evidence, and neither are they great at this knowledge exchange function. I'm particularly honoured, by the way, to have Miriam Ben-Peres as my chair, because I've admired her work for many years, and I don't think we've actually met. I want to draw on the 6 years I spent in government, a specific review I did on research mediation, which is hopefully about to be published, which was at the Toronto study leave, the sabbatical I had at Toronto for a few months, and the 30 years I've spent in research. And I have to say that we don't have the answers. What we do have, I think, is a lot of is increasing experience of how we might go about this. So, what I want to cover is something about why this is so important. Many people have already made reference to this morning, but why is making better use of research so important, especially in the current climate? Secondly, what do we know about how research, when it does influence policy and practice, how it does so? Thirdly, what we can do to improve the current evidence base, the current evidence capacity to use evidence in policy making and in the education services. I'm working now in children's services, but we're talking today more about education services. I'm going to actually move this now because I'm picking up the translation a bit too much. Okay. The fourthly, how we can make sure that we invest in the future evidence base in a way which will improve its quality. And Rami's already made reference to the tensions and the balance needed in assuming randomly controlled trials as a gold standard, but I want to talk a little bit more about that. And finally, how do we assess both the research itself and its impact on policy and practice? So that's quite a lot, and I intend to stick to the time I was given so that we do have time for your both the response and for the questions. Okay, so 3 main reasons why I think we are compelled to make better use of research. And I'm drawing in the first one on an English example, but there is no question that this is an international issue across the world, because we increasingly in this climate need to justify public spending. So this is a quote from a study by Stephen Scott and others, very well-known researcher in England in parenting, psychiatry of parenting and early years work intervention, and who has done some excellent trials in this area. And he is basically arguing that the cost, I tried to translate the English figures into shekels for you, hoping it would make a little bit more sense. But the cost of not using evidence is far too great. And he's arguing, although this is an old study, 2001, it's not very recent, nevertheless, he's arguing that the cost to the services, to the education system of not using good evidence is simply too expensive, even before we get on to the other arguments. It's always easier to demonstrate these things easier, though not completely apparent, to demonstrate these things in medicine and in education, and you'll know those arguments and those comparisons are very often made. The second reason I want to suggest has to do with the moral imperative, and I'm going to quote Anne Oakley a couple of times in this lecture. But the moral imperative, she argues, to ensure that when we provide services to other people or intervene in their lives, we do so on the basis of the best possible evidence. And here, again, a comparison with medicine is always tempting, where you can demonstrate fairly easily that using the wrong evidence kills people. I've often argued that in education we also kill people, we just do it more slowly. We kill them by boring them to death in the classroom, and we, in some cases, not by any means all cases, that's not, I'm not being critical of all teachers by any means. There are many reasons. In England, in particular, we have such a prescribed system, or have done in the last 5 years, that we bore them to death in the classroom through absolutely no fault of the teacher. So we have a situation here where there are problems in terms of what we cause, relating actually to the previous speaker, potentially to contributing to even to violence through extreme frustration. But we also kill them long term by, if we pay attention to the links between educational outcomes and subsequent employment, health, housing and so on. So let's not think that it's only in medicine where not using evidence causes dramatic problems. The third imperative, which I'm not going to go into in great detail today because it's too complicated, but I think it's worth acknowledging that in many countries, and certainly in England at the moment, there is an academic imperative to make better use of research and to design research with better use in mind, because funders will not give us money anymore without a plan showing how we intend the research to impact on other academics and also on the services where that's appropriate. And in addition to that, we have this assessment exercise, as we call it. At the moment it's called the Research Excellence Framework for assessing all research in the UK, which then determines the subsequent 5, 6 or 7 years funding arrangements for universities. Some funders, not many, actually require an impact report. At the moment, the Economic and Social Research Council in England requires an impact report 12 months afterwards. I think we decided in yesterday's meeting that 12 months is probably much too soon, and that's one of the problems. That if you're going to have a system which helps to determine whether to give somebody a future grant, you have to make the decision fairly quickly on whether their work is having appropriate impact. On the other hand, if you want to see the true impact, you might have to wait 30 or even 40 years. So, what is the problem in terms of lack of evidence-informed policy and practice? I'm using the term evidence-informed rather than evidence-based, partly because of some of the points that Rami made about transferability and taking account of the context. First of all, there is good empirical evidence to suggest that policymakers, and we can have a debate about who are the policymakers, but politicians and senior administrators do not rank academic research in education, or I have to say in child welfare, as the most important source of information. So consistently, surveys of various types have been found to show that people like special advisors or experts who may or may not have a good academic track record, or think tanks, which are probably a little bit less prevalent in Israel, but I'm not so sure about their role here. Certainly in the US and in Canada and in England, are much more likely to be privileged as sources of information in government decision making. That wouldn't be true of teachers. We'll come back to teachers, but in government decision making. I lent on the. I just find the right place. Sorry, I lent on the space bar by mistake. Okay. So, secondly, policymakers often regard, with good reason, research findings, research reports as impenetrable, ambiguous, conflicting, or insignificant. And most importantly, and I think Sela made reference to this in her introduction this morning, they're not timely. There's a time cycle problem, which we might want to come back to. So, when I worked in government, ministers might want research information in 2 hours, and you don't actually have time in that instance to consult everything and to draw everything together in a reasonable way. And it's not their fault because they've only just been told that they're going to be on the television or the radio in 2 hours. It happened to me in relation to formative assessment. I had to pull all the information together within 2 hours. But actually, there's a bigger problem here, that even if we manage to get the profession to a position of having a thirst for evidence, or we have an expectation in society that they will use evidence, nevertheless, it isn't always available in a form where they can use it quickly and easily. And I think that's something that you are addressing, I'm going to come back to in a minute, and that we are also trying to address. Thirdly, this is a slightly, perhaps too English example for you, but if you're familiar with the English newspapers, The Sun is a newspaper that favours photographs and pictures and cartoons rather than any kind of text. So that will give you some idea. And this was a wonderful Member of Parliament who sadly lost his seat in the last election, who is a medical person, and he gave he made this statement in Parliament during a debate on cancer, where one of his so-called colleagues, another Member of Parliament, had chosen to quote evidence from the Sun newspaper. And the point he's making is about the status of evidence. So he says that since she quoted evidence from the Sun, I want to refer to a recent edition of the British Medical Journal. And that illustrates some of the tension in people not agreeing about the status of different kinds of evidence, which other people have already also referred to. So, what are some of the barriers that we meet in trying to, as a country, to try and, in this country and in any of the other countries I'm going to quote, in trying to help evidence to be better used, help people to make better use of evidence? The first one for me in 1997, when I went into government, was the sheer size of the problem. So we had 500,000 teachers, even more than double those numbers of teaching assistants in schools, and 2,000 at that time, 2,000 central government administrators, civil servants, policymakers working in education. And after 6 years, when I chose not to renew my contract for the third time, and when asked why I wasn't going to do so, it was as a result of a conversation with the chief person at that time, the Director General of Schools, who said, "Your work doesn't seem to be having much impact." And I pointed out that there were rather a lot of people to have an impact upon, and that in addition to the 500,000 teachers and the 2,000 administrators, as is the way in government, particularly in English government, many of the administrators who I had an impact on had then moved to other areas of government like defence or the Treasury or somewhere else. So the first point I think that we have to acknowledge is this is a very big task, whichever country we're in, and we need to think very carefully when Rami talked about local building up of research evidence, which I agree with wholeheartedly, but we need to think about the top down, the bottom up, and the scaling up of any system to actually meaningfully impact on these large numbers. And the examples I'm going to give you in this lecture, most of them have not been successfully scaled up yet, so that's a big challenge for us. Secondly, I've already made mention of the fact that accessing relevant evidence is not easy, and many people in the professions lack confidence to judge that evidence in the way that some of you who are researchers do automatically in your day-to-day work. Thirdly, this is a wonderful quote that I've never been able to find the original source of, but Keynes, who was a famous economist, said, "There's nothing a politician likes so little as to be well informed. It makes decision-making so complex and difficult." The pace of life in government is such that it's actually unrealistic to expect policymakers to want research evidence, because there's no way that in drawing up policy options very quickly they can expect to access any detailed evidence. Fourthly, and this is a rather more complex argument, but I'm sure it's one that you've already come across. An ex-colleague, Stephen Webb, who's now in Australia in social work, talks about evidence-based practice, and the resistance in social work is at least as strong, by the way, if not stronger than in education, to evidence-based practice among some people. He talks about it being a problem because it manufactures the idea that it legitimizes having a set of strict guidelines. So in the way that, if I use the example you may be more familiar with, in England we have something called the National Institute for Clinical Excellence in Medicine, which translates research findings into guidance for doctors. And the doctor can flick on the laptop while you're in their surgery and find the most recent key messages about a particular area as produced by NICE into guidelines aimed at doctors. And what Webb is arguing here is that if you do that in the professions, social work, education, and tell people exactly what to do according to the evidence, you stop them thinking. So if you like, it goes against, it conflicts with reflective practice, which I guess is dear to many of our ways of working. And I think it's an important point. I'm not sure that I don't think it's impossible to address that point. You don't have to tell people exactly what to do every minute of the day in order to make evidence more accessible to them. And finally, as we've already seen, and Rami has illustrated, what counts as evidence, the nature of it is very much contested. So, one of the issues I raised yesterday, and I'm still not entirely clear about in your system here, is how far you feel that the use of research, let's not yet get on to engaging in research, but the use of research is an expectation for teachers. I don't know whether it's really spelt out in your professional standards. I understand that there is reference to use of data, I think, in the professional teaching standards. In England, it is not in there at all. And the standards have only just been revised. We have new standards from September 2012, and research isn't mentioned in there in any form. And I think that while we don't have that expectation, I'm not trying to say that if something is legislated, that will be the answer to its use. We know from many examples, as I'm sure you do, that legislating for things doesn't actually mean that it will happen. But nevertheless, it's at least a start to give clear messages to teachers coming into the profession that there is an expectation to use evidence. It's certainly in the medical standards. The medical standards, of course, go much further and talk about the need for doctors to be engaged in actual doing research or engaged in research teams from time to time. But there is no reference. And this quote from David Hargreaves, very well known in the educational research field, suggests that in some contexts, in some school cultures, the teacher using research would still be regarded with suspicion. And when I used to teach at Cambridge with Hargreaves, we had a wonderful example of a secondary school teacher, special needs coordinator, who was on the master's degree and used to turn up, a part-time master's degree, used to turn up every Wednesday afternoon. And we used to see her in the car park moving her papers for the session from a plastic supermarket carrier bag into a very posh leather briefcase. And when we eventually plucked up the courage to ask her why she did this, she said it was because her husband had brought her this beautiful briefcase to try and encourage her on her higher degree studies. But that if she walked into the staff room with this briefcase, they would say, here she comes with her fancy ideas. So, I think there is still an issue for us in terms of culture. Sorry. Okay. There have been many explanations given in the literature as to how the process works of getting research into practice, policy or practice, but I'm going to focus here on practice a little bit more and argue that none of these explanations are entirely sufficient, but they do give us some ways forward. So there is an assumption that if we just, there has been an assumption in the past, I should say, that if we incentivise researchers to spend more time disseminating, all will be solved. Well, Ben Levin's research has shown very clearly that pushing the research out does not guarantee any kind of use at all. The second explanation talks about incentivising those who are expected to use the research, and that if we incentivise those people, somehow the research will be better used. And although there is certainly more discussion of this, and in some places, particularly in Ontario, there's actually training for policy officials in how to use research and how to understand research. I think, again, this on its own is not sufficient. What we do know is, and in many ways, Carol Weiss's work years ago demonstrated this, that it's the interaction which is crucial. And however much we use internet and other forms of electronic communication, there will perhaps remain some need for face-to-face discussion of what particular findings mean and how they are implemented in practice. So building on the networks that exist are crucial, and in the school, in terms of the school system, building on existing networks has been shown to be very, very important in terms of getting research better used. But I put here without losing research integrity, because our research colleagues in England would talk about people who, I don't know if this phrase translates, so I apologise, into Hebrew, but cozy up to policymakers. You know, they're too close, they develop too close a relationship to government, and then they lose their research integrity. They just produce the findings that government want to hear. So we have that tension in the system between needing to maintain the research integrity. And also, even if we can get this relationship between research and policy and practice absolutely right, we must remember that not all research actually shows us the way forward. And the best example in England of this, where there's been absolutely lots and lots of research, lots of money spent on research, would be the attainment gap between the lowest performing and the highest performing students. And we've got lots of research, which indicates some contributing factors, but there are no clear answers. Okay, improving the capacity building in the system to use research. I'm trying to keep an eye on the time here. Did we start about 1/4 past? Yeah, okay. I was asked specifically to mention the Teaching and Learning Research Programme. When I was in government, £80,000, which I think translates, roughly speaking, into this number of shekels, was spent over a long period of time, 10 years, looking at schools, further education, higher education, research, focusing on teaching and learning, on the grounds that previous research had insufficiently addressed classroom-focused teaching and learning, or whether the classroom is a university or a college or a school. And this programme had certain criteria which all projects had to meet, which included very strong user engagement plans, strong dissemination and impact plans, a strong focus on student outcomes, and usually collaboration between disciplines, which was something which people raised yesterday in various meetings that I had. And if you go to this website, you'll find I think a lot of projects, over 50 projects, maybe even as many as 100 projects, which were funded under this programme. And some of them have been hugely successful in terms of impact, and some of them less so. And I'm going to give an example of a project later on which is linked with this programme, although not funded solely by it, which has had a big impact. The second major initiative, these are not in order of importance, these are just examples. A second initiative, which has been aimed at building capacity in the system, has been producing systematic reviews. And I don't know how big the debate is in Israel about systematic reviewing. The international methods of systematic reviewing, which have been built on the Cochrane collaboration methods, which were introduced for healthcare, mainly around the Campbell collaboration, which operates in education, social welfare and criminal justice. And my feeling, but I might be wrong about this, is that in Israel there's maybe more debate in criminal justice on systematic reviewing than in education. I see one or two people nodding, so I hope I've understood that correctly. Without some form of reviewing, robust reviewing, there is a problem about how the professions access quality-assured synthesis of the research. We're not really expecting the average maths teacher to read 150 studies on maths education. So if they want to know which kind of maths schemes are particularly successful, or which kinds of teaching arrangements in the classroom, group work or individual work, or those kinds of things, or feedback are particularly helpful, how do they make sense of this huge array of research? They're not doing a doctorate or a master's at the moment. How do they make sense of it? Where can they find a few pointers to what the key messages are for the staff meeting that they're supposed to be talking at this afternoon? So that's why we commissioned the Epicentre in London to develop systematic reviewing, which they'd already been doing in health promotion, on education and subsequently on social work, social care. And I would say this has been partially successful. We have over 100 reviews, and each of those reviews have a very short summary. Some of them are a little bit longer than the 2 pages they were asked to produce, but nevertheless, that's a good start. I would still argue that to scale this up internationally, the Campbell system and the EPI system are still too labour intensive. They're too complicated, they're unnecessarily labour-intensive, even to maintain that level of robustness. I don't think they need to be so complicated. And that's, I think, an area which needs international attention, because if one country or several countries are investing in that kind of system, there is no need for another country to set up another system in parallel. This is something that electronically we could easily do right across the world without too much trouble. But we need to make it much more manageable than it is at the moment, and we need to follow, which I think was a brave start but didn't quite get there yet, the example of EPI in bringing together different methodologies within synthesis, research synthesis, not just privileging only one kind of methodology. The joint practice development work, this may not mean much to you, it's a form of collaborative continuing professional development across schools. It's something I've been doing for the last year with the National College of School Leadership in England. I simply want to make the point here that some schools in England have been identified by the government, for better or worse, as teaching schools. Those teaching schools are expected to lead on initial teacher education, on middle leadership, on a whole host of responsibilities. Many people would say far too many if they're going to be effective. And one of them is research. And they are beginning to work on that. But I've just spent a year working with 5 teaching school alliances. They're groups of schools working together, led by a teaching school. And I have to say, I saw very little evidence of the use of research in that work. And worse than that, I saw one example of a major conference being hosted by the Teaching School Alliance, and the main speaker being somebody who is very well known in England and whose work is totally not evidence-based, and in an area where the evidence is rather poor. So I think that's a problem for us. Even when the teachers were engaged in research with us, they didn't recognise it as research that they were doing. So we've got a number of problems there to do with the culture. And finally, there is an expectation amongst funders that users will be much more engaged in the research process. Teachers, social workers, etc. will be actually involved in determining research priorities and making sense of findings. But I have to say that at the moment that remains somewhat tokenistic, and one of the things we're trying to do in the new centre, which was set up with this kind of principle in mind, is to involve foster carers in actually undertaking the research, and young people who are in care, but at the moment foster carers. Last week we trained the first 10 foster carers in interviewing techniques to interview other foster carers, because we think we will get more authentic outcomes. We will need to test it out. Okay, I'm running out of time, and I might just skip 1 or 2 points, if you don't mind. I'm assuming that these slides will be available later on. We do have, which we set up when I was in government, a National Teacher Research Panel, which are a group of teachers who've actively been engaged in research themselves and who offer their services to government, to funders, and to other teachers to encourage the use of research and to comment on research from a teacher perspective. We also have an interesting initiative in Canada, which I think has been replicated in other areas, and this is in the child welfare area, where they summarise monthly journals and discuss them with practitioners through video conferencing. I don't have time to go into great detail, but you'll find that journal watch on the website. It's run by Aaron Schlonsky in the social work department, coordinated by him in Toronto. And we have different kinds of researcher in residence schemes. You'll probably be familiar with the idea, I don't know, of having an artist in residence, yeah, in an institution, having a painter or a sculptor or somebody in residence who stimulates discussion in that area. We have had schools where researchers have spent a period of time with a group of schools or in a school to stimulate the use of research and sometimes to help them to do better practitioner-based inquiry. This other scheme here, where I've mentioned the website, is actually funded by research councils, and is not just about educational research, but it's about bringing physics researchers or historians into schools to talk about their subject in a way which will entice, they hope, children to take more interest in research as a career, as or in understanding research. Okay, I'm going to miss this out. I just want to make one point here, which is that Farrington in Criminal Justice makes a very important point, that it's not, I'm going to talk a little bit about weaknesses in research, but he talks about the weaknesses in reporting research. And if you've been involved in any systematic reviewing, that comes through very clearly, that we still have a massive problem with very good research which is very poorly reported. Okay, this is adapted from a relatively recent paper written by 4 funders of educational research in the UK in children's services, and it's an analysis of 625 studies. You'll find this doesn't end up to 625 because I've reduced the number of categories and left some out because I just wanted to make the point that the bulk of the research in children's services work, as is true in education. Education, if you just took education in England, you get a very similar kind of analysis. It might be marginally stronger on quantitative, but I would doubt it. So we have 230 studies, 37% that are purely qualitative, 17% mixed method, and so on. I find it worrying that there were only 2 systematic reviews, 3 randomly controlled trials and 8 non-randomized trials. Even if we don't privilege these, this is nowhere near enough to tell us what works. I think that's the critical point. You know, I'm not arguing for RCTs and RCTs alone, and I would never do that, because I don't believe we'll be able to answer questions about how things work. But we don't have enough to tell us what works at the moment, and I think that is a problem. And the Education Endowment Fund, which has been given 200 million by the government and by the Sutton Trust to fund RCTs in education. That's a new initiative. It's been going about a year, and they're summarising the evidence in what they call a toolkit on their website. But we also need, and Rami made reference to the databases, and we need more work on more people with the skills to interrogate databases, more longitudinal studies. I'm going to talk about EPI just in 1 minute. Trying to finish now in the next few minutes, if that's all right. And we need more mixed method studies, or studies which are linked between quantitative and qualitative, even if they're not mixed method designs, to tell us both what works and how it works. And perhaps more than anything, we need the quality assurance and synthesis that will enable us to start looking at how we might scale up these practitioner or locally based inquiry. I'm going to skip this and just say that the OISI unit, Research Supporting Practice in Education, is one of the few that is empirically interrogating research use. So what have they found? They found that, sadly, when they took knowledge claims, which were statements of practice in education with a very strong evidence base, and they used these to mediate head teacher, principal, study groups, and provided resources and support to back up the schools using the evidence, there was still very little impact. There was some impact, but it wasn't very much. They also found that universities were not providing leadership on knowledge mobilisation, and they also found, and they haven't finished this study yet, that grant holders who had research council money were very variable in terms of how much they were able to earmark, how much funding they could direct at knowledge mobilisation. There are initiatives in both Canada and England for educating the media. I have to say, I don't think they're going to work, but they're brave attempts to educate the media to report research more responsibly, And in Canada, it consists of a panel of people, you'll know the people, Michael Fullen, Lorna Earle, very well-known people in educational research, who, when the press publish something which is clearly wrong, they counteract it with a factual analysis of the current evidence, and they present it to the journalists, and they try to get it in every newspaper. They've done it on a number of key issues. In England, we have an ex-minister, Estelle Morris, who is just launching now an education media centre to broker between journalists and researchers. So, knowledge brokering and research mediation, whatever we want to call it, is key to trying to get this relationship improved. But we do need to be aware that, and these people play important roles, such as in the commissioning and reporting of research, to act as interpreters between people from different communities, in defining the problem more clearly, and in making better linkages with research users. But we do need to recognise what Stephen Ball has identified as the multiple positions of people in think tanks who operate on the councils of each other's organisations, who speak at each other's activities and events, and who Diane Stone, who's a political scientist, has referred to as regurgitating garbage, which is a bit fierce, but the message is important there, which is about how their work is not necessarily research-based. It can be media-based, it can be communications-based. And Haas, who reminds us that these people are taken as credible sources by the press, but the work has not been peer-reviewed. If you're interested in this work, the place to look is the Boulder, Colorado website on think tank research quality, which is run by Wellner and colleagues, and their conclusions after reviewing 59 reports from think tanks, mainly in the US, but not all, some of them I regret are in the UK, said that many of the nation's most influential reports are little more than junk science. So, this project, the EPPE, is an example, perhaps, of the best example we have in England of a study that's been influential on both policy and practice. It's longitudinal, it's involved initially 6 years, but now it's been going for more than 13 years, taking young children and following them right through. Next year, they leave school, they reach 16 next year. And this is the longest study of this type, with both quantitative and qualitative data, and it has influenced government policy and it has influenced practice. So it's influenced the expansion of nursery places, it's influenced the early years curriculum, it's influenced the workforce remodelling, and it's influenced practice. Why has it done this? Partly about timing, partly about mixed methodology, partly about very clear messages, partly about being responsive to policy and practice changes. But look what they've had to invest in this. This is 1 month from March 2007, and these are the dissemination activities that a very small team of people, 4 or 5 people, engaged in during 1 month of the project in the early days, in terms of dissemination and knowledge exchange activities. And I think that shows us and reminds us that when we're getting research grants, we need to negotiate very carefully about the investment of time. Some people say as much of a third of the resources needs to be on dissemination. So, we need to make use of the best available evidence. We need to consider the professional standards. We need to look at the infrastructure in policy making. I believe, and I don't know that I've heard that much discussion about this yet here, but perhaps it's early, we need to improve access to synthesis, quality assured evidence in priority areas. We need to support practitioners to use research, in some cases to engage in it, and we need to develop a closer collaboration between researchers and professionals in some cases to do that. But most importantly, if we do try these initiatives, we need to evaluate them in terms of how far they're able to produce better use of research. And just to end with Anne Oakley's position on this, which is that if we're going to intervene in people's lives, we have a moral obligation to do so in a way which will produce most benefit and least harm. And I'm sorry, because I think I've been a bit longer than I intended. Thank you very much.
Thank you very much, Professor Seger. I believe strongly in this exchange of knowledge, and we heard a lot about the British experience, both in synthesizing research, in dealing with research use, and some of the terms that you mentioned should be really guiding ideas. When you spoke about capacity building of users, something we don't do at all. So thank you very much, and there'll be time, I hope, to interact further beyond this one session. We now continue. I'll speak briefly as in response to what you said, but I'll do my best to leave enough time for all of us to talk. Though this arrangement is not very conducive to interaction, we'll try to do our best. There is a Hebrew saying, צרת רבים חצי נחמה. The shared problem is already half a consolation. We share the problem of not using research with many other domains. I'll give two examples. One from medicine. There is a lot of evidence based that people who deal with sick people should wash their hands. Okay? This started in the 19th century. Now we have evidence that not more than 50% of doctors or nurses do wash their hands. So, it's a real problem. It's a dangerous problem. And we don't know what to do about it. In education, there is evidence-based material that if teachers would only expand the time between asking a question and expecting a response from one student, from many students, if they would expand the time, what is called wait time, from 1-2 seconds to not much, to 10 seconds, more of the students would respond, would give higher quality responses. Teachers were told to use this method, and they really liked it. The only problem was that once it started, they went back to their classrooms, they forgot all about it. And again, wait time was 1 second. Now, Schulman suggested a very important term, and I would like to suggest this term for all research use. There is something called the wisdom of the practitioner. And not all the knowledge that is accumulated in research fits the wisdom of the practitioner. because there's lack of time, because there are conflicting values, because there are other things to deal with. And for instance, in this wait-time study, they found out it's very nice for a teacher to be quiet for 10 seconds. But now try this in a live classroom. Immediately there's chaos. So we have to be wary of the expectation that all evidence-based knowledge will or can or should be used. Now, one more, I don't know to call it a suggestion, one more comment. We live in not only in a capitalist society, but in a knowledge-based society. We, the Western world, not all over the globe, we in the Western world. And there is a strong belief that if you do something and you can really show that it works, then everyone should adopt it, right? But it turns out that the more important and the most impact is not when we have research knowledge, but when we have ideas. An idea like open schooling, like, just to mention Dewey, active learning, pedocentric teaching, kinds of group work, or any other great idea you might think about. Ideas have impact. Not all over the globe, not forever, many interpretations. Dewey didn't like what they did with his idea. Gardner doesn't like what they do with his idea about multiple intelligences, but ideas have power. Now, what do I mean to say? Do I really mean to tell all of us that we don't need this research and evidence and that attempts to have teachers use it? No, we do need research. We do need to know what works. But we have not yet, and we are far away, but I really do thank you, Judy, because you suggested some remedies. Because we need these remedies if we want to improve schooling. Not because we need better grades. I don't know whether you are aware that the education ministry is very happy because Israeli students did well. Well, I'm not so sure this is the only important criterion for the success of education. But we do need this as well. It's never either or. We do need research, we do need evidence, but we don't know how to overcome some of the inherent cultural, historical, practical problems. And I'm just going, as I am a chair, I have to be careful of the time. Because once they let me speak, there is no announcement. I'd like to mention some other remedies beyond those that you suggested. For instance, there is an issue of amount of knowledge and the rate of trying to introduce it into the system. You can't force too much, too quickly, or too many. You can do it only with different taxes, but even this doesn't work too well. Then there is an issue of optimum redundancy. You do need to repeat and repeat and repeat. And you do also need to connect, to integrate not only knowledge about one certain problem, like teaching. I come from science teaching, so I always give examples for biology. And when you talk about biology teaching, you always talk about teaching photosynthesis. I don't know why, but this is the usual thing. Now, you may be able, not easily, to integrate evidence about good, not best, but good ways of teaching photosynthesis. But that's not enough. The biology teacher teaches other topics as well. So you have to be able to integrate beyond those borders. Timing. Timing, when is a system ready for a certain kind of change? This is a very complex problem. You know, we all are in a very difficult kind of practice because education is so complex that it's easy to give up. I always thought, until a short time ago, I thought that in medicine we have a lot of evidence and we know not what to do. Now I understand medicine is not much better, but in education it is really very complex, very difficult, takes a lot of effort. And therefore, and also, it's not like giving someone an injection, like, I don't know, in medicine, and next day you will feel better. Education takes time. But ministers of education don't have time. Parents don't have time. The only ones who have a lot of time are students. They couldn't care less. You said something, Jody, about teaching the media. Because our lives are almost ruled now by the media, this is possibly, potentially, one of the most important routes to using research. But then we need what is called vividness of presentation. In our own closed circles of academics, we are used to listening to talk. Teachers are tired of talk, and you suggested a beautiful theme. Imagine this teacher among teachers trying to give a short lecture on research. Not only won't they listen, they laugh at it. So, vividness. We are not good at it. We don't know how to present our very hard-gained knowledge in a way that would engage the interest of the viewer, the listener, the audience. And now I am going to say something I myself don't like, so I'm sure you won't like it. But one of the ways of ensuring some use of research knowledge is by using the capitalist way of paying, giving rewards to teachers who do use research, promote them, show the whole profession that it matters. Now, when does something matter? When we are ready to pay for it. And I'm not necessarily talking about money. No, I'm not necessarily talking about money. A very brief number of further comments. The research long ago, and you know the people, J'Oody, Brown, and McIntyre, who many years ago, studied the implementation of some knowledge in science teaching in schools in Scotland. And they found, not surprisingly, that when the idea that the ministry wanted to implement was something administrative, like from tomorrow morning there won't be grouping. You need heterogeneous classes. Or this dream that for the junior high school you don't need to teach physics and chemistry and biology separately. You teach something called science. How do we achieve this? That the same teacher has to teach all three subjects. And you won't allocate hours in schools for 3 teachers, only 1 teacher. So they had 1 teacher. But what turned out, this teacher, if he came from biology, he focused on biology. And if he came from chemistry, he focused on chemistry. So you can't change the administration. You can't change the pedagogy. And because much of our research deals with pedagogical issues, a priori it is difficult to expect use. These things are very difficult to implement. The UNESCO several years ago appointed a committee to suggest common, worldwide goals for education. The Delors Committee. The Delors Committee came up with 4 goals. In Israel, everything is 3, but they were not Israelis, so they could go one more 4. And one of them is learning to know. Now, most of the research focuses on learning to know. And this indeed is very important. But there are other goals. And there is not enough research on these other goals, like learning to be a human being now in the 21st century, or learning to act. Now, one of the things that happens when you try to use research, you have to be able to act upon the knowledge you learned. But learning to act is more difficult than learning the facts. When we heard before, when Professor Benveniste had this intriguing title, Na'aseh v'nishma, or Nishma v'na'aseh, it's easier to listen than to do. And therefore, the old Jews in previous times were very wise. Somehow we lost this wisdom along the way. But they were sure that you have to focus on action. And in teacher education, we don't even teach in detail, for instance, what does it mean to hold a discussion? So we don't deal with the acting, with the practicals, with the clinical aspects of teaching. And then we expect them to use research knowledge. And another important goal, learning to live with each other. And I think that the more time passes, the less yes, we do research on how to teach that and how do you succeed in using these kinds of ideas. Now, as I told you, could have gone on for hours. First of all, I love the topic. Secondly, I love to teach and to talks, but I'm going to stop now, and now it's open for you. So thank you again, Jody, and please, it's your turn now.
No, we need it to the microphone. We need it, otherwise it's not recorded. It's not recorded if it's not to the microphone.
Okay, I take a note that I wrote because I already forgot what I wanted to say. It's another aspect, another difficulty. Some people mention.
They're not getting. Are you speaking in English or Hebrew? Okay, okay, no problem for me. I don't know whether anybody's having a translation the other way.
Okay. There's another aspect of difficulty that was mentioned in passing about the timeliness. Beyond the issue of distribution or dissemination that takes time, beyond the issue that the decision makers need the information within 2 hours, it just takes, I don't know, 18 hours to assemble it if you're very good. It's the fact that even if I, as a researcher, I'm not, but even if I am as a researcher, I find the right question, and I find the funding, so looking for the funding, and I find the funding. Okay, I'll try to speak even louder. Even if, as a researcher, I take the time and I find a good question, and I take the extra time to find the right funding, and I take the extra time to find a way to plan my research in a way that it will really answer the questions, and I take the time to execute the research, which takes quite a while. It could take quite a while, and then I take the time to analyze the results. Then somebody else takes the time to peer review it. By the time it is considered valid, it's been years, and quite likely the questions have changed. The surrounding environment has changed quite a lot. We live in times where technology changes a lot, and it affects how people are, it affects how kids learn. They have new opportunities, they have new limitations, and the very good question that I had 8 years ago is quite irrelevant by now. And this is an issue that, of course, I don't have a beginning of solution. There's a really serious conflict between having relevant information and having rigorously checked information.
Yeah, let's take some comments, but please, because of the lack of time, there's always a lack of time, we also cannot implement what we want to do. Be brief.
אני רק מבקשת שהדוברים יגידו את שמם גם לצורך ההקלטה
אמיר לוקח.
תודה. מי הבא?
Good question. Judith, do you have an idea how the percentage of research results are
high-stakes testing are going to do tremendous damage to the motivation of students and teachers. But this doesn't change the opinion of policymakers that will actually improve motivation.
And Jody, it's your turn.
עוד שאלה אחת כך מהקהל.
זו מרים אמרה אחרונה, תבדקי איתה.
Okay, just a few quick comments then. I think I'll go for your question first, if you don't mind, which is the one about the percentage of research that's reflected in policy. And I think that one of the interesting things about that is, of course, we don't know is the answer, because what we don't know and what we suspect is that, for example, when the very influential work of Paul Black and Dylan Williams was first published on formative assessment, the formative assessment policy in England did not change. There was no sign of any impact, even though the report was much debated and on the news, in the newspapers, correctly and incorrectly reported, but nevertheless it was very high profile. 18 years later, it was picked up by a different government and it became absolutely central to what was called in England the Key Stage 3 strategy, the secondary school strategy. And I think, and Paul Black, who is a wonderful person, if you've ever met him, he shrugged his shoulders and he said, I don't understand why after 18 years suddenly somebody's interested in what we said. But of course, the timing is critical. And at any given time, a policy might pick up on a piece of research that was published a long time ago, and we wouldn't necessarily know. And certainly with very controversial research, like the research which showed the damage of testing on young children, I know, because I was in government at the time, that the ministers were beside themselves. They were very worried about it, but they didn't say anything in public. They kept going with the testing, they were committed to the testing. So I think when you say what proportion, at the moment I would say, I would go on the other way round. The proportion of policies which explicitly reflect research is quite small. Maybe, I don't know, 20% or maybe less than 20% in education. But the proportion of policies which are at some time influenced by research will be much higher, because each piece of research might be getting into the thinking of senior administrators or politicians and used at a later date. So I think it's less direct than in the sciences. I'm sorry that's not a very good answer, but I think it is impossible to see that direct relationship and quantify it. There's the questions about conflicts, which both the other questions are about conflicts. One about time versus rigour, and the other one about conflicting evidence with policy or
Beliefs.
Beliefs of teachers or beliefs of
teachers.
Okay.
I think that was
yeah.
You spoke about conflict with ideology of ministers. This is another thing.
Okay.
Teachers.
Let's just go for the teachers, first of all. And there is a real issue here about, you asked the question, didn't you? There is a real issue here about the fact that at the moment teachers and social workers and all sorts of other practitioners make decisions every day, and mostly they make them on the basis of their beliefs rather than on the basis of evidence. So how we change that balance, I think, is very problematic. It's not just about the fact that the research conflicts with their beliefs, it's that it isn't in most people's normal daily behaviour to think, what does the evidence show on this? And we know in England, I don't know whether it's true in Israel, that some of the most popular practices and that teachers believe in, like brain gym and learning styles and all sorts of things, are not well evidence informed. So we have a problem there about challenging those beliefs. What we do know is the people who are most successful in challenging those beliefs are other teachers. So the kind of model that our national college is operating and that your Avnei Roshat is operating to to try to get people, teachers, to deliver the messages to other teachers, leaders, school leaders, is probably going to be more successful. And I think you and I should talk over lunch. It's not a quick answer to your question, but I don't believe that maintaining rigour is just about time. It's partly about time, but I think there are other issues there. We do have researchers who are now more willing to be what I would call less precious in sharing at any given time their findings to date. And I think you can say, and most politicians would be sympathetic to you saying, at this point in time, this is what we believe. When we get to the end of our study in another 2 years, we might think differently, and we don't want to be held to what we're telling you today.
Thank you. Do we have time for
another one?
Thank you very much. As the previous chief scientist, I agree to every word you said and gave me a lot of food for thinking. I have two short comments. One regards the media and the other one is the good news. Regarding the media, I must say, as I was nominated to be the chief scientist, the first meeting with the media, they said you have 2 minutes, or the journalist said, I have 2 minutes to present the item on the television. The issue was very complicated, and I said to myself, how can I present it in 2 minutes? And they said, that's it. Otherwise, I would cut it and edit it to be presented in 2 minutes. And I think we, the researchers, have to be used to the media. 2 minutes, no matter how complicated the issue is. This is one comment. The other comment, what I said, the good news, it may be the new ICP and the very fact that information flows so quickly, so fast from one place to another. This is the good news. I had a teaching method that I designed myself, and I think regarding it combines metacognition with education in very, very short. I think I got at least, not at least, on average once a week, a request from a teacher all over, not from Israel, all over asking me, oh, I read your research in so, please send me more information. Please send me, I guess they like to have practical information, not the research and so on. So the very fact that people apply, teachers apply, and very often I ask them, where did you hear about that? Because they don't go to conferences. They say, I read it somewhere. And unfortunately, all my publications are very scientifically, it's not, my publications are not written for teachers, unfortunately. But still the teachers apply. So I see it as a good news that something would change maybe in a very short time.
I'm going to just respond quickly to your first point about the media. I think the second one was really a comment rather than a question, wasn't it? But just to say, make a couple of points. One is that the work that I mentioned that Ben Levin had conducted has affected some of those universities in terms of investing in more media training. And I have to say that I did some more media training myself recently. It was the second time I'd done it. And as soon as I got into the real situation afterwards, I still went to pieces and didn't say the right things. So I think some people are just better at that than others, and maybe people working in areas like mine, which is a bit more of a marginal area. You know, it's not, it's very hard to get the media interested in looked after children unless there's a crisis. When one dies or is abused, then they're very interested in it. But the rest of the time, they're not that interested. So you don't get enough practice, which is part of the problem. But certainly there's been more investment in how we work with the media, but I think these initiatives that are trying to get the press to be a bit more responsible will have marginal but a little bit of an effect. I don't think they'll ever get there because the prime reason for a reporter to produce a report on research is to sell more newspapers. And if we remember that, we would be wise to remember that, because in the end, it's not because they're nasty people or because they don't understand what you're saying. It's because the job is to sell more newspapers or radio programs or whatever it happens to be.
Thank you very much. I think our time is over, but it's such an important theme, and we are so lucky to have Jody with us. So I hope there will be more opportunities for each of you to interact with Jody or with each other. Toda Rabba. Thank you very much.
המושב הזה, כפי שאתם יודעים, מוקדש למוטיבציה, והפעם דווקא מוטיבציה של מורים.